So now we move to a very important part of the meeting. We've concluded hearing from the lupus community, at least for today. And, we've been very fortunate to have a number of members of the Food and Drug Administration be amongst us, listening both here physically in the room and many more on the web. It is a great honor to be able to have someone from the actual part of the FDA that provides advice to drug developers developing drugs for lupus and will ultimately be the part of FDA that reviews new applications for drugs for lupus. So today, to provide our summary remarks, we have Dr. Nikolay Nikolov, the clinical team leader from the Division of Pulmonary, Allergy, and Rheumatology Products at FDA's Center for Drug Evaluation and Research. Dr. Nikolov.
Good afternoon, everyone. Do you hear me? So it's really exciting for me to see this full room. This is really indicative of the importance of this event to the community, and I think this is really a historic milestone meeting. My name is Nikolay Nikolov. I'm a clinical team leader in the Division of Pulmonary Allergy and Rheumatology Products, and this is the division that oversees the drug development and review for products for rheumatology, including lupus, lupus nephritis, and all of the related conditions. And I'm also an adult rheumatologist, and I have to confess that lupus is near and dear to my heart. In my formative years as a fellow and subsequently as a staff clinician at the NIH, I did some research on lupus and Sjogren's syndrome, and I was a part of the clinical team that took care of patients or people with lupus in the bone marrow transplant at the NIH. So I and my colleagues from the FDA are honored to have the opportunity to be a part of this landmark event that has brought the lupus community together to advance the development of new therapies for the disease. For this opportunity, I would like to thank the organizers of this patient-focused drug development meeting, the Lupus and Allied Disease Association, the Lupus Foundation of America, and the Lupus Research Alliance. But more importantly, I would like to thank all of you who came today and overcame the challenges and discomfort of travel, and for those who couldn't attend but are actually they're attending remotely on the phone and on the webcast to share your powerful stories. We recognize that it takes time, effort, and courage to talk about your experience with the disease. As physicians who take care of people with lupus and do research on lupus in the lab and in the clinic, we think that we understand the complexity of the disease. However, today's meeting was a sobering and humbling experience in that it has reminded us that there is one more very important aspect or dimension to the disease, and this is that of the people with lupus and their families and the struggles they face every day. And that sometimes the way we measure disease activity as clinicians by measuring protein in the urine or cell counts in the blood do not necessarily reflect how patients feel and experience their disease. So today I was tasked with the not so easy job to reflect on that experience and summarize what I heard. I'm a bit nervous whether I'll be able to capture it all, but I'll try my best. Please bear with me because I have to shuffle my scribbled notes. I really appreciate this opportunity to share this experience. So many of the themes that I heard today were common to many of the stories, but I also appreciate that each person has brought their unique experience and expertise and perspective, which made this discussion even more powerful. First, I would like to mention how I heard you describing lupus. And besides the standard or well-known definition of lupus of this being chronic and multi-system prototypic autoimmune disease, disabling and sometimes fatal, I also heard the words being used to describe it as capricious, unpredictable, Also that every day is a mystery, and also being described as swimming in shark-infested waters where you don't know when you would be bitten and how badly you would be bitten by the shark. I was also moved by the description of the disease as being invisible and hard to tell if a person is sick. And this is true not just for friends, family, but also for experienced clinicians. I was also struck by the description of the experience of mortifying to see the dirty looks of others when you cannot really do a simple activity like climbing a flight of stairs or taking a stroll. So apparently, lupus has taken a physical and emotional toll on all of us, on all of you. Then in today's discussion, there was an emphasis on symptoms, and I thought this was very important to hear how they impacted the quality of life. And the main symptoms that I heard discussed today were by far, number one, fatigue, which is the most disabling and most common symptom that impacts the quality of life of all people with lupus. I heard this being described as leaving people lifeless, like a vampire sucked out our blood. No energy, unable to get up in the morning to get kids ready for school, miss out on interactions with family and friends, and also need to make adjustments to one's life to overcome these symptoms. The next main symptom that I heard was brain fog and fatigue, brain fog which might be related to the fatigue or forgetfulness, which in some cases impacts one's ability to interact. Also for someone who made them unable to do math and they had to give up a career, or for another to lose train of thoughts, making you take a backseat at work. Another important symptom that was described today was depression, which made some paranoid that something bad is going to happen today. All the symptoms that were described were pain from arthritis or fibromyalgia, dry eyes and dry mouth related to Sjogren's syndrome, Raynaud's phenomenon, hair loss, and functional limitations. So recognizing and understanding how these symptoms relate to each other, overlap, and interact, and how they are distinct was very helpful for us and for me to understand and hear. And one very important key theme that I heard today was the loss of one's quality of life related to lupus. And that resulted, or that prevented people with lupus from doing regular activities or pursuing a lifelong dream. And it appears to happen not only on the worst days, but also in the best of days. For some people, lupus resulted in giving up career as a vet or as any other dream that they had. It impacted on personal relations, including relations with kids, spouses, and friends. All the descriptions that I heard about how lupus impacted quality of life included robbing people from kids, robbing them from interactions with kids, robbing them from the reliability of a friend or as a coworker. So lupus so life took on a new direction with the diagnosis of lupus, and this usually happens in the prime of one's life. As you know, the incidence of lupus peaks up during the most productive years of one's life. And that leaves life filled with lost opportunities. There were also some fear expressed about not knowing what tomorrow or next year will bring. or about how that might impact friends, relatives, and whether the kids may develop lupus. I heard the importance of support also from family, friends, and help with some of these issues, including having a teenager take care of her mom. There was a big emphasis on the need also to plan, even for routine activities, such as planning for a block of time to take a rest in any given day, use sunscreen, dress to protect from sun or cold. And it was planning for both before and after the activity and how to handle the fatigue from overexertion after the event. In that context, I also acknowledged the need for people with lupus to make different modifications and how even with these modifications they couldn't do what they actually wanted. I also heard about therapy considerations, insurance, cost, and financial burden. One point that was emphasized today was the acute need for therapies, biomarkers, tools, and predictors of disease progression and prognosis. And while there are some therapies available for helping people with lupus, there is a high unmet need for more safe and effective therapies. And it was noted that treatments are needed to manage daily symptoms, functional impairment, fatigue, preventing progression, organ damage, and disability. There were also discussions on the complexity of risk and benefit for such therapies and the burden of therapy, such as ovarian failure, hip fractures, infections, hospitalizations, and also risk for unborn child. But throughout today's discussion, despite recognizing the negative impact of the disease on one's life, I was actually moved by the positive attitude people expressed for hope, optimism, and perseverance. So in my mind, today you're making history. Today's meeting was a very important dialogue for us, and I hope that this will be just the beginning of that will lay the foundation for future conversations. The lupus community is clearly engaged and eager to participate in this effort, which is reflective of the strong desire to keep optimism and hope despite the challenges of the disease. While my remarks may not have been detailed enough, the organizers will provide a comprehensive summary of the meeting in a publication called Lupus Patient Voices Report. And this report will provide the FDA with a very important tool which will help inform the agency's decisions during drug development and the review process. This meeting has been as important to us as it is for you. So on behalf of my colleagues at the FDA, thank you for having us here, and we really appreciate it.
Thank you, Dr. Nikolov. And in addition to the very detailed report that the meeting organizers will be submitting, I was sitting at their table. I saw the volumes of notes that Dr. Nikolov and his colleagues were taking. So I know that they have quite a bit to take back and share with their own team. So thank you so much for your participation today. So in closing, in addition to what was just shared in terms of a brief summary of today, we thought it would be most appropriate to leave you and all of us with some of the actual words that were shared. So I'd like to share some of them with you. So here are just some of the quotes from today that will surely leave a lasting impact to all that were here. I'll read them. We really haven't made breakthroughs like we have in other disease areas, and it really is time. I never fully recharge. It's hard to correlate how you look with how you feel. Finding an ideal treatment is a challenge. It makes me feel like I shouldn't do things halfway, because if I do something halfway, I might not be able to do the next thing at all. It's difficult to tell if you're feeling that way because of lupus or because of the side effects. And every day I'm in pain. We were just going to have one slide of quotes, but we felt that there were too many, and certainly this is not even with 2 slides going to be all-inclusive, but here are some additional ones we wanted to share. If there were something that improved our quality of life, that would be the best gift. Moments like this give me hope for the future. We've got to ride the storm together. The doctors really can't do anything for you. That's what we have to do, make every day count. Treatments are short-term decisions that have long-term implications. And lupus is a disease of many surprises. I think these and all of the experiences shared today really help capture truly the burdens that you face. And I know that it has been quite a learning experience for myself as someone that is a relatively new ally to the lupus community. But having shared this, I want to just, on behalf of the collaboration between the Lupus and Allied Diseases Association, the Lupus Foundation of America, and the Lupus Research Alliance, thank you all again for your participation. Please submit comments if you have them in written format to info@lupuspfdd.com. And please continue to work as a united community to continue bringing the voice to drug developers, to FDA. You have amazing organizations to work with, and it's been my pleasure working with you today. So thank you, and have safe travels home.